Briefing us next is going to be DHA's Acting Assistant Director for Healthcare Administration. And man, you look sharp in his summer whites. Rear Admiral Matthew Case. Welcome to the stage, sir. Yeah, awesome.
Thanks. Hey, good afternoon, everybody. I was thinking of, I don't know, back to 2020, there was ESPN had a game on the other night, and it was, do you remember the cardboard cutouts of people in the stands during the baseball games? Pat, next year you got to get cardboard cutouts for the end of the last day. No, good afternoon, everybody. I purposely asked for Paul to extend because, as you can see, I get that every day from Paul Courts. He starts our morning huddle every day, and you all need to experience what we get to experience every day. And I say this with all seriousness. Paul Courts is a national treasure. And thank you, Paul, for your never-ending commitment to hold us accountable for what we can't do. We cannot fail our patients, and you hold us accountable and our teams to do that. So thank you. I lost track. I have a few remarks, but the LEAP frog score grades are incredible. And I think a few years ago we were saying, I don't think we should be doing this. I mean, I'm about being transparent, but I don't know if we can get the data. And I'm embarrassed that we couldn't do that. And for us to be where we are today and to celebrate A's. And what Paul didn't say, there are some health systems that we rely upon very heavily, and that our patients think are premier facilities. And if they pull up the LEAP frog score grades, they'll be very surprised what the A is. It's that lovely little MTF down the street. And the B's and C's are the ones that they think are the cutting edge facilities. So I'm very proud of our organization where we are. And Paul, thank you for reminding us what a cool organization and dedicated team we work for. So very quick, I asked to be the wrap up, and you had a chance, if you go to the next slide, I do that, my bad. Boom. Yay. I want to cover, what I'm covering is what was already covered. That's why I'm pleased. Everyone did my homework for me, so I'm going to be the wrap-up guy. But I'll talk a little bit about digital health, our clinical care, which Paul just covered. Gina did a phenomenal job covering our healthcare operations, and then I'll just talk a little bit about our cycle of our patient visit. That's me, terrible photo. Last time I was here, I got a chance to speak to DHTS. It was in Orlando, and it was about 180 degrees. And we walked through a lovely pool area, I think. And I remember I was on a panel. I was Navy Day, and I got the rep. I was a brand new flag officer, and the Surgeon General gave me an opportunity to excel. And people were talking a little bit about this AI thing, and they were talking a little bit. And they came to me, and I said, you know what? Could we just talk about downtime? And the room erupted in cheers. Hey, can we just have a system that requires downtime in seconds, not days and hours? And I got a standing applause. So I was like, that's cool. But it's so much more than that, and it really is. And I appreciate systems that are doing the things they need to do to take care of limiting exposure to downtime. But it really is, we have to have a health system that's responsive today, and for the future. And we rely on all of you to help us to get where we are. So I think it was on Tuesday, it was Tracy Farrell gave you a few thoughts on our digital and our health integration way forward. To me, this is how we leverage technology to get the vast data that we have, and how are we using that data to, one, promote the health and well-being of our patients. I didn't say provide care, the health and well-being of our patients, so we can prevent those episodic care opportunities wherever possible. How we are preventing and using technology to enhance our ability to practice medicine, to improve our patient experience. And we'll talk a little bit about ambient listening towards the end, but I am blown away by just that mere infusion of technology in our system, what we can do to enhance both our practice but also our patient experience. And then I'm sure Tracy covered kind of where we are looking at the technology that you all have and that you all know about. It may not even be technology that you all have, but there's so much out there, and helping us connect to that is really critical. Let me see if I did the next slide. All right, well, Paul covered all things clinical opportunities. And to me, that is, how are we ensuring that we are providing safe patient care no matter where we are? From the tertiary, the level 1 trauma center at BAMC, to being on a small boy on a ship somewhere off the coast in the middle of nowhere. How are we providing that highest level of care, and how you all can help with that. The video I saw that John DeGoes was running yesterday, imagining the patient from, it gave me a little bit of memory back to days in Afghanistan. The initial casualty, hearing it on the squawk box, the dust off going out, and then being able to capture that, every part of that encounter. And so when you hand it off all the way to Walter Reed, and sometimes it was within 96 hours, they have a whole record of the care. That's phenomenal. My one concern I had during that, though, when he was talking about it, I saw the iPhone. And I thought, great, I have another provider that's not looking and listening at me. They're in their face on their iPhone, they're on their laptop, and they're not having that exchange. So how are we doing it? Is there going to be some tool with ambient listening that will gather that information and not have that corpsman become an extension of our healthcare system, which doesn't appear to be patient-centered? So that was the cynic in me. I was so excited. I'm like, here we go. We're putting technology in between our providers and our patients again. So I ask you all to think about that as we're doing this. How are we enhancing those opportunities? I'll see if I can get to the last slide. There we go. And healthcare operations. This is the team that you heard Miss Julian talk about yesterday, and she's another national treasure, like Paul. Dedicated to make sure that every encounter from start to finish, that we are taking care of our patients, and we're leveraging all those tools to do that. From before you even need an appointment, are there access? Is there ample opportunity to be taken care of before that? Do we have the wellness nodes in place to take care of our patients so they don't need an appointment? And when they do, do we have the responsive tools to do that? And then also helping, how do we help the front end technology, the front end and the back end technology, so that we can provide value to our organization by demonstrating what we're doing. So I thought she did a great job with that. And then this last slide, I have a hard time seeing it, but it just recognizes that our patient visit is a cycle. And it starts HCO, all those things we talked about, those core capabilities up front, making sure that we have access to appointing, making sure that the front desk staff knows what they're doing, is able to operate at the top of the game. Where can we leverage technology in that to help make sure that our patients, before they even come into the system, know how to access the system? I always hear, we love you when we see you, but we hate you because what you make us do to get into the system. So how are we leveraging those technologies up front? One, to make it seamless and easy, so when you need something, you get something. And then maybe you don't necessarily need something, but we've provided a way forward where we can help you with that. I mean, that's that front office piece. And then leveraging the leadership and those people we have in those workspaces that are optimized to be able to do what they need to do at the top of their game. That's where I think technology plays a big role. And of course, what Paul talked about, how does technology help us data mine? How does technology help us provide, precision medicine? How are we able to focus on getting at disease and leveraging technology to get there? Seeing some of the latest imaging studies and things that you can use with AI to see that. It's amazing. How can we leverage that, and how can you help us with that? And the back side, I'm going to hand off to Miss English in a few minutes on the J1 side, but she's embedded with the J8 team there, and all of that support on the back end is essential for us, that we're able to document and provide the level of service that we can justify and demonstrate our value that we provide. We're a organization according to Leapfrog in 75% of our facilities. Is that right, Paul? 75%. We provide incredible amounts of care. And in many cases, we rely on gentlemen like Paul Courts to, as soon as he's done with his patient encounter, to go in and fill out a form so we can cost account for it. That's a terrible use of resources. We need to be able to have back-end functions that are supporting our patient care and demonstrating the value that we provide. Just like we want to be able to provide that level of medical record completeness from blast injury all the way to Walter Reed with that video, we need to be able to do the same on our accounting piece, so we can demonstrate the value that we provide to the department, and more importantly, that we provide to every taxpayer in this room. So that's kind of the backside piece. So I think that's the conclusion of my slides. I wanted to say a couple of things that you probably heard Dr. Farrar say and Dr. Deal, and I apologize. I wasn't here on Tuesday. I got tagged with another mission, but we made it Tuesday night. But I think they probably talked to you about the military health system and our core requirements. Probably heard about force generation, right? We are a system that must generate forces to be able to go downrange and do the things that they need to do. We're essential for that. But at the same time, we must be able to force develop. We recognize, we learned this back thinking about COVID. We did not, the community exceeded our capabilities, and we had folks all around the country backstopping critical care sites throughout the country because there wasn't. And what we learned from that is that there's not enough seats in our GME programs to train those folks as well. So we have got to train and develop our own. The force development piece is critical for us to be able to be downrange to support the fight tonight and the fight in the future. So we have to force generate, we have to be there, while at the same time we have to force development our folks. And then the third thing that we must do, and I just came back from Japan last week, 10 days ago, Darko, was it? I think 10 days. What's on their mind now? Last year, if you read the Early Bird, there was a lot about, hey, we need access to care. We don't have enough appointments in our system. Our civilian workforce is stressed out. We did a lot of things to help with that, and the teams did amazing work working on some Space A opportunities, working on International SOS, providing some contract support for insurance coverage. Now that that's settled down, you know what everyone's worried about? China. And they're worried about how they're going to run a system that is in a combat environment. They're worried about how our hospital's going to respond to that. They're worried about how we're going to medically, how we're going to provide logistics during that time. They're worried about blood. How are we going to get blood there? Those are all the key things that DHA is working on our combat support agency side. So for us, we have those key missions. And you heard Paul talk about it. You heard Gina talk about it. You heard Tracy Farrell. We're all in support of Dr. Smith, Dr. Farrar, in that mission to take care of those three critical elements. Generate the force to get out the door. Develop our folks to be able to support wherever need to go. And finally, we have to make sure we have that combat support requirement locked down. So the ask to you is this: we need help. So I appreciate the opportunity. I got a chance to talk to several of you, but we need help. This isn't a time for us to say, yeah. We need big ideas. And the constraints that we fall under. We had acquisition day, and I learned a bunch of new things. So we have acquisition law. We have systems that we're worried about China. Pat and I were having a conversation about China just before you started talking, Paul, so about intrusions and stuff. So we have to have a system that can't fail us there, but we need your help to get after those key things because our country's counting on us to do that. And how we do that is with your help and with our team.